Bruce, real quickly, do you mind if we record the session?
Not at all.
Great. A few people just emailed me asking for a recording.
Wendy.
Hi, Alice.
Hi, Alice.
Hi, Alice. Trisha's there. Wendy Silverman. Lots of friends.
So if you're just joining us, if you could
Anna.
grab a piece of paper and a pen or pencil, there will be opportunities where we're going to ask you to jot down some ideas. You will not have to share them and you will not have to draw anything, but it would be helpful if you have that next to you. So we have about 40 participants. We're expecting quite a few more. We're going to start the program in about 3 or 4 minutes.
Hi, Dr. Hirsch.
Hello, Dr. Fernari.
Hello, Alice.
Hi, Alice.
Who said, oh, is Katie Perlman there, my best friend? Was that Katie?
Yep.
Yeah, I recognize your voice. I don't even need a picture. You're in my mind. You just live there.
Hi, Taranji.
Hi, Katie.
Hi, Alice.
The
Just-
Waltons.
Hi, Nancy. Hi, Bruce. Hi,
Okay, we have every bestie here.
Penny is, look at this.
Hi, Tricia.
And Trisha, oh my goodness.
Trisha.
Katie, you're so lucky you have Kay. I just got off the phone with Marcy. She's coming this weekend and she looks pregnant.
Oh my gosh. So exciting.
Crazy.
So amazing.
Yeah.
She's doing October.
October 31 on Halloween.
Oh.
Wow.
She's gonna have a little baby.
Barbara's here.
Very exciting.
Is
So if
Barbara
you're,
Hirsch?
if you're just joining us, we're going to start the program in about 2 minutes. We're just all saying hi to one another. So you can quickly unmute yourself if you want to pipe in, but we are going to keep everyone on mute during the program until we open up the Q&A. If you can grab a piece of paper and a pen, we are going to ask that you jot down a few ideas. You will not have to draw anything, and you will not have to share unless you want to, but it would be helpful.
Put your porca down.
It's her best friends.
Say hi. Say hi, Katie.
Hi, Katie.
Hi, Monica.
My goodness.
Hey, Matt.
Hi, Mahak. Hi, Katie. Hi.
Katie has a fan club.
Hey, Katie came over. Both kids were like fighting for her. Katie has a huge fan club.
We all have to congratulate Bruce.
Oh.
Right, Bruce? Yeah.
Congratulations.
Yeah, thank you so much.
The pictures were so beautiful.
He had a first child married. Very exciting.
Oh, very wonderful.
Very exciting.
Congratulations.
The next exciting thing is the last child married.
Okay, so I think we're going to get started in the interest of respecting everyone's time. Thank you all for joining us for this very special program, The Art of Observation and the Patient's Story. If you're just joining us, grab a piece of paper and a pencil because you will be asked to write down a few items. You will not have to draw anything and you will not have to share. So I'm going to ask that everybody keep themselves on mute because we already have 65 participants and we're expecting a bunch more to join. And when there is opportunity to speak, you can unmute yourself. If you would like to speak at any point during the program, if you simply type your first name into the chat bar, I will then, or Nancy or Bruce will call on you and you'll be able to unmute yourself and speak. So we're going to go to the first slide where I will introduce, or the second slide, I will introduce Nancy Richler. So I'm very proud to introduce Nancy and to have her here with us this evening. If you don't know Nancy, she was recently retired as the director of the Hofstra University Museum of Art. I'm sorry, my phone just went off. Nancy has a long history of collaborating with the medical school on numerous wonderful programs, helping us to utilize art as a way of learning. One of the first programs that she and I worked on together was a program where we looked at artists in history that have used creativity as a way of coping with suffering. And we also did another program more recently on helping us develop cultural competency in transgender care. And both programs involved a visit to the art museum on campus where we looked at various works of art, and then we heard from our medical experts tying in what we learned from Nancy with clinical care. She's also juried our annual art shows, and she has served as a faculty for our fourth year Health Humanities elective, welcoming students to the museum to teach them and going to hospitals to teach residents about observation through art. And most recently, Nancy was a member of the cast in our theatrical presentation, which was a lot of fun. So Nancy is an art educator who uses art to teach enhanced skills of observation, and most interestingly, to me at least, how different people see things very differently. The use of art in medical education is being recognized more and more as an important and effective tool, and we are very proud to introduce Nancy to work with us tonight.
Thank you so much, Lisa. It's sort of like coming home, even though I am home. I wanted to thank you for inviting me, Bruce for sharing this evening, to Alice for keeping me involved since really the inception of the medical school in 2008. Never in my life did I think that I would be somehow so connected to medicine and the field of medicine. And yet, I think that's one of the wonderful things about life is it takes unexpected turns. So I'm thrilled to be here. And I just wanted to go over, just to repeat what Lisa had said about something to jot some ideas down or some drawings if you wish, about typing in the chat box, and I will call on you. And most importantly is to please don't be afraid to speak up. I'm going to be asking some questions which may seem obvious as far as their answers, but that is part of, I hope, the realization that nothing is obvious to everybody. And so begins this interest in art museums and the medical practice, which really took off in probably around 2005, 2006. And more medical schools are working with museums, and they have found a number of benefits. And some of those, they all deal with enhancing clinical skills of observation and diagnosis, developing communication skills, both listening and speaking, expanding one's sense of empathy, and becoming more aware of one's own biases and assumptions. And I think that's all because of the power of art. And I hope we will now have an opportunity to, let's see, I'm going to share the screen to see just what the power of art is. So this evening, the first half of this evening will be looking at a couple of works of art and discussing it. And then after that, Dr. Hirsch will take over and we will discuss art in a different way. So the first, let's see, first thing I am going to ask you to do is simply look. And I would like you to just take a look at what you see in front of you as we jump in. And now, let's see, I need to find, whoops, the chat. You know what, how do I find the chat box when in screen share?
You know what? I will read the chat for you. I'm not sure you can.
Okay, great. Okay, so my first question is, what's going on in this picture? I invite you to take a look and think about it. Tell me what's going on in this picture.
Just type into the chat bar what you see. So Nancy Burlow says, most likely a dead baby with a very sad mother.
And what makes you say that, Nancy? A dead baby with a sad mother?
Nancy, you can unmute yourself.
Oh, and I do see, okay, I found the chat. So, yeah, what I would like to do, if I call on you, I would love for you to unmute yourself so we can have a bit of a conversation.
Okay, I'm here now. Can you hear me?
Great, yes.
Okay. Well, I guess I'm saying it because my field is perinatal loss. And this does not look like a baby who, I would imagine if this was a newborn baby or a baby would be wrapped better. When I've seen pictures of, you know, I have seen pictures of dead babies and they're kind of can be folded up limp like this baby looks. Maybe I've gone to the extreme because it's reflecting what, you know, part of my my background and my professional experience.
Okay, so you're using your background to help inform. what you're thinking this is. Somebody else, let's see. Lauren Block says something seems wrong between the woman and the baby. Lauren, do you want to explain what it is that you see that makes you say that?
I guess it's like the expression on her face just seems sort of so like impassive towards the baby. Like, you know, it's not one of like love or admiration or even like I'm tired. It just she like almost has no emotion on her face, and then just like the baby looks naked, which I think is concerning because it looks cold outside.
So unlike what we just heard before, where the baby might be dead and the mother's sad, this might just be no affect at all. But disturbing that the baby is on the bed and not wrapped up. Okay, and how about Christopher Awad? When you said postpartum depression, what made you say that?
Again, I guess the mother just looks very detached from the baby. The baby obviously looks very young. I guess that's kind of like, as a family medicine physician, that's sort of one of the things we learn to look out for after a baby is born, when you're following the mother, just to be concerned about that potentially developing. Yeah.
Thank you. And Tricia also said that the mother is concerned looking. So we've had a number of different thoughts about the emotional state of the mother, whether she is depressed, concerned, completely flat, sad, and thoughts about the baby needing warmth. Why isn't the baby being held by the mother? So Alay Kawam, I'm not sure if I'm saying your name correctly.
It's Alette. It's Alette.
Alay. Do you want to explain your comment? Repeat what you wrote and your thoughts there?
I think I said that, why is everyone's like reaction so sad to that photo? I guess I was a little like, why did we assume the worst? I mean, I understand, you know, there's a lot of like physicians in medicine, but I think like people started jumping to a diagnosis like, oh, she must be depressed. Oh, the baby must be dead. Or, you know, she's having postpartum depression or something like that. And I'm like, well, why are we making all these assumptions? I mean, I get it. I get like it's cold outside, baby's not wearing clothes. I mean, it just for me is like, you know, as a physician, it's like we're like looking and we're automatically jumping to an answer or, you know, like we're viewing it as a problem. You know, we're already looking at it as a problem, like a diagnosis that needs to be fixed, as opposed to just kind of like, you know, oh, you know, the maybe this painting or whatever it's at night and it's snowing outside and something like that. You know, it's sad, it's depressed, it's whatever. So for me, it was interesting to kind of see a perspective where we're looking at things already as a problem.
So, which is really interesting. So you're commenting really not so much of what's going on in the picture, but the reaction of everybody else to what's going on in the picture. It's something to keep in mind. And what else can we find? What else do we, I can tell you, let's see, some other people have said, someone said, it looks like a motel. Where is that? Let's see, Francine, you said a woman with an infant, the key is in the door. It looks like a motel. You see the key in the door. Do you want to explain any more about that?
Yeah, I mean, we don't even know if it's the mother.
Aha. Interesting. Yeah, we don't know it's the mother.
It looks like a motel key to me.
What makes it look like a motel key?
Well, it doesn't look like a key you would have to your house. Just that what do you call it? Like diamond shaped plastic thing is usually what they have in a motel. Not even a hotel anymore, but a motel, or a cabin in the woods. So you don't know if it's. I mean, we really don't have context to know who the woman is, and I think of all the comments about the baby and the woman, the baby not having anything, even a diaper on, is just very unusual. I mean, and from, I don't know, on my screen, it's a real baby. It's not a doll. I don't know. But it looks like a baby, but it looks, and is it real? Is it just her imagination? She's looking at something. But it doesn't even have a diaper. That's like really unusual. And there's nothing under the baby. So I don't know. I mean, and there's something to cover the baby with. The green thing there, she could cover the baby with. So it looks like a motel room because of the phone and the bed is made.
So we see the green here.
So why is the baby not covered? Or
Good.
have a diaper?
And we'll go back to that key in the motel room. If it's a motel, is there anything else that might tell us it's a motel room?
The bathroom is very stark. Someone made a comment about being super clean. So
A number on the door.
Is there a number on the door?
Yeah, right here.
It's like a cabin or a motel room.
Can you see, do you see where the laser is? I don't know if it's a little red dot. Okay, great.
There's also a car parked very close to the entrance, which typically indicates that it's a motel. There were taillights in the original picture you showed.
Okay, and do you
on the
see,
left side?
do you see that the original picture is up again?
Yeah, so you see the car right there on the left. Yeah, it's pulled all the way up.
Right here.
Yeah. So there's just a lot amiss and none of it's adding up. There's also medicine on the nightstand and the bed is perfectly made. So there's a lot going on there that's not telling us the whole story. And she seems to have a bruise on her arm.
Anything else that we can find? There's an awful lot here and an awful lot, whoops, that is left unsaid.
You see the number 1 right next to the window. So you see that there's another room right next to this room. So if you just zoom out a little bit, right there, you see a 1 up by the window.
So right, yeah. Which gives more weight to this being a motel. So if I can help us put it together a little bit, some people have said it's very cold because we see the snow. And there's snow on the car. In a motel, a woman, and a couple people said it's a woman with an infant without creating a relationship of whether this is a mother and who that child is. A couple of people said it looks like a newborn. She is by herself from what we can tell. She seems to have a bruise on her arm. There's medicine by the bed. I don't know if everybody can see. I'm thinking the person who made that comment is talking about right by the lamp. There seems to be something. Okay, let's see. Is there anything that I didn't say? There are so many comments.
I don't see a bed or a crib or any place that the baby could sleep.
So again, this baby seems to be just sort of out in the world without the kind of care that we would expect of a newborn or of an infant. Although somebody else said, maybe we're just catching the mother, this is Shrija, maybe we're just catching the mother in a rare moment of peace. Like she just finally put her baby to bed and she's just gazing at that baby. And Greta said the same thing. Could the baby just be sleeping peacefully and the woman looking on. Any other thoughts? If you'd like to unmute yourself, people seem to be able to do that without speaking over one another. Wendy Silverman said she noticed that there's a rotary phone here, which gives a sense of time, that it must be a long time ago because of the phone. And in fact, yeah, I wonder if, I think motels still have landlines, I wonder.
It's really interesting, Nancy, that everyone's mentioning that the baby doesn't have clothes. I remember one time my kid was crying, and my mom just made my kid butt naked, and my kid was happy. So I mean, maybe this is a tired mom, and the kid wouldn't sleep, and she just undressed him.
Interesting. Good. Yeah. So it goes back to what the one of the viewers here said, that interesting that we jump right to there being a problem. Somebody else said, could this be about domestic violence? Marie Cavuto Patrizio, do you want to explain that a little bit?
I mean, I just thought it looks like she doesn't really have any belongings with her, no diaper. She doesn't have any clothes for the baby to bundle it, and it's apparently very cold outside. And, she looks distressed. She's in a hotel, and maybe that bruise on her arm, if that's a bruise. So I thought maybe she was just trying to get out quick and left with her baby.
Okay. And one last comment, Agnes said she noticed that there is one pillow rather than a double bed or place for two people to sleep, possibly. I'm saying that. And she appears to be alone. So we have sort of a mystery here of who the mother is, or the woman is. Is she a mother? Is she somebody else? Who the child is? Where are they? Why is to have the glass door? So Jenny said it's interesting that the door, while some people saw it as ajar, Jenny noticed that, let's see if we can get it, it's actually a glass door. So we are left with a lot of unknowns. And that is how we're going to leave this, which I think for a lot of people, I know for me, I always want to know what's the story behind this work of art, and I will tell it to you in a moment, but I would like to take just a moment to sort of unpack what we did in this activity. Does anybody want to speak up? You can either chat or unmute yourself and say, what is it that we did here, and did anything surprise you? So Alice, these are coming in so fast. Francine said we observed and everybody saw something a little bit different. Lauren Block says it's funny with a group of medical providers and educators that we jump to the diagnosis, which I think makes us consider what kinds of contexts and assumptions do we bring with us to almost all of our interactions, but particularly in this situation. Ellen said it's interesting how together we helped build a story, and that someone else said we saw it from different approaches. Sandra said that, that we seem to frame it in our own references. It's a good word, framing, for this. Rely on what we already know or have experienced. So, and somebody said many people jump to the story without the evidence. So, which is, what makes you say that? What, which is very important in this strategy of looking at a work of art and saying, what makes you say that? Like the key. What makes you think that it's a motel? Because there's a key that some of us might recognize as being from hotel and motel. Okay, we are going to go now to a similar activity, although first, this is a photograph by an artist named Gregory Prudson, and the photograph is called Birth from 2007. And Crudson's father was a psychoanalyst, so his works, his oeuvre, as we said, are just filled with ambiguous scenes, mysterious moments, often taking place in small towns. And he creates, they're really like stills from a film, except it's just that one photograph. So we can talk about that later if we have a chance. So we're going to take another approach to art, looking at it differently. For this work, and this is where if you might want to write down, I want you to take a moment to look at this. This is a detail of a work of art. And I would like you to look at it and then think about what might the bigger story be here. And you can just, if you want to just jot that down. If you want to jot it, if you want to, you could actually, I suppose, put it in the chat room. Sorry, I've never really used the chat box like this, so I'm learning as we go. So if anybody wants to say what they think this might be, or just keep it to yourself, and I will show you what the larger image is. So here we have, let's now take a look at this work of art. So some people felt that this had to do with a seamstress because of the sewing machine. Is that why? Anne Fried, I'm going.
Yeah. Yes, because of the sewing machine and the apparatus, I don't sew, so I don't know about sewing machines, but I know you need that thing on the floor for it to operate. And also that the top was hanging, but they look like a part of the outfit that might be in production draped over the chair.
Okay. And now that you see the larger picture, what more can you find out about this, the person who sort of lives in this room? Alyssa, you said it definitely is not what you thought it was going to be. Do you want to explain that a little bit?
Sure. So when I first saw, I thought what a lot of people saw was that it was probably some sort of seamstress or somebody working on making an outfit. And now when I see the whole thing, I get a very different idea of what the dress is for, based on how the woman is lying in the bed. She with some sort of plant on top, and another woman is sort of like taking care of her. It appears to me that the woman is sick, and so it kind of gives a whole different vibe to what I was thinking in the storyline.
And what makes you think she is sick? I see that from lots of people, so if you don't mind being the spokesperson at the moment.
So the way she's lying in the bed, I mean, it almost looks like she may already have passed away, but I honestly can't tell. But that's sort of how very often people are, lying on their back perfectly still. And I know different people use different sort of things, placing flowers or plants, things like that. And you can definitely tell that the woman is taking care of her. And there's also medicine on the bedside table.
Okay, so we see the medicine, and you said, and somebody else might want to speak up as to why it is that you think that the woman is taking care of the woman in the bed. Let's see. I'm trying to get back to the chat room here. Does anybody want to say, let's see, it looks like there's family or friends who care about her, that there might, somebody says the leaves, Francine said the leaves over her looks like a religious rite. Francine, do you want to explain that at all? What makes you say that?
I mean, it looks like, fronds that this woman is holding over her. I mean, you wouldn't normally do that. It's not, so maybe it's a cultural tradition to try to make someone better, or I mean, I'm assuming she's still alive. I can't really say. But there's also something at the foot of the bed, that blue canister with steam or something coming out of it. And I don't know what that actually is.
Right here.
I don't know if that's like a vaporizer or a humidifier or like something else. And then the I guess child who's at the foot of the bed, kind of leaning over, is saying something about him caring about this person. I don't know if it's his mother or sister or someone else. You don't really know whose room it is. You don't know if it's her room or her parents' room, because there's parents in the cross above her, but you don't know if that would be the parents' room and she's just in it. And you don't know the seamstress either.
Yes, who is the seamstress? Somebody said the purse, Linda said the purse on the chair tells me the woman is visiting a sick person. And there are many others that might tell us something about this woman. Judy Ann said the person in the bed seems to be looking at the woman over her, and the body posture is very caring. The woman standing over the bed is very caring because of her posture. So what we're going to do, because the time is up actually, is I want you, this is called The Healer, and it is by Carmen Lomas Garcia, and she is a Mexican-American woman, artist. So I want you to think for just a minute, we'll take 1 or 2 minutes to discuss sort of the difference of looking at, of what surprised you in doing these 2 exercises. Thinking about the questioning, and the first exercise is called VTS, Visual Thinking Strategies, which is an approach to looking at art where there are 3 questions. That is it. And I want you to think about it as it connects to your professional practice. What's going on in this picture? What makes you say that? And what more can we find? And if you think about that from your own medical perspective, I'd like to hear some of your thoughts about this, and also about the first image we looked at from the whole, and then began to look at the details. Here we started from a detail and began to work our way out. So it was a slightly different approach, but I think, as somebody said right from the beginning, it was a surprise to see this, because the whole picture wasn't exactly what you expected. So just to look at what we did, we began really looking at the details. Again, think about the medical practice. We refined the story using the evidence. The question, what makes you say that? People spoke about the key, about the phone, about the baby without wearing any clothing. We listened to one another, and that helped, as somebody said, help build the story, which then revised our thinking. And we had to deal with the ambiguity here in both works of art of not knowing really what's going on, which, and we were asked to make interpretations. And so you did with the information that you had. So does anybody want to say anything about what we did before this goes back to Bruce? And feel free to unmute yourself.
So we are going to have opportunities to ask questions of Nancy and or of Bruce at the end. So if the question occurs to you, you will have another opportunity to speak to Nancy after we hear from Bruce. And Nancy will also, if you will put your contact information in the group chat if somebody has a question for you after the program.
Okay, I will do that. And I also wanted to thank you all because the chat room, the chat box has so many fabulous observations. Normally this is done in a gallery setting, so it's a very different orientation. But thank you all very much. I'm going to stop now and turn this over to Lisa, and I will put my information in the chat box. Thank you.
So thank you so much, Nancy. That was really enlightening, really fascinating, and we appreciate that so much. I now have the pleasure of introducing to you Dr. Bruce Hirsch. Dr. Hirsch is an assistant professor at the Zucker School of Medicine and an attending physician in infectious diseases for Northwell Health. His approach to clinical practices encompasses his passion for the psychological, spiritual, and emotional well-being of his patients, and is really evident in everything that he does. He is one of the co-directors of our medical school elective, The Healer's Art, a very special program that he's been involved in from the start, and serves as a faculty member in our fourth-year elective program. And he's also involved with our MAP-IT mentorship and professionalism and training program at Northwell Health. So without further ado, I would love to introduce to you Dr. Hirsch, who will discuss the therapeutic power of clinical perception using the metaphor of patient as art.
Thank you so much, Lisa. Nancy, I was really moved by that experience. I feel like looking at art really changes us. Our perception is challenged. The way we look at things becomes altered, enhanced by that act of focused observation. And so we're leaving the art gallery now. And what I'd like to do is to take that perception and bring it right into the medical clinic. And we'll do that virtually with imagination and an exercise that we'll do in just a moment. So I ask you to consider is an old metaphor, goes back many years. William Shakespeare gives Hamlet these famous lines. I really like this. What a piece of work is man, how noble in reason, how infinite in faculty, in form and moving, how express and admirable, an action, how like an angel, an apprehension, how like a god, the beauty of the world. And excuse the gender bias in the old literature, but our species as a piece of work that is the beauty of the world is just an inspiring metaphor, a real different way of thinking about other people, about thinking about ourselves, particularly helpful during this very, very challenging time. So the metaphor is more literal in more ancient poetry. And there's this line, yet you have made him little lower than the angels and has crowned him with glory and honor. And that's from the 8th Psalm, composed about 3,000 years ago. And that idea, conveying the concept of personhood as divine creation, is another example of that idea of the person as a created work of art. So we're transitioning now to the, and let's maintain this way of seeing and considering other people. I invite each of you to remember a patient that you have met. If you're an educator, if you're in a different profession, if you're a baby, it doesn't have to be a patient. Let it be any person with whom you're spending some time. And don't try too hard. Just let someone come to mind. There might be a series of persons who, and welcome them all. To see them better in this exercise, in this clinic, let's close our eyes for a moment. So close your eyes right where you are now and take a deep breath and blow out slowly. Take a deep breath again. And now examine the person in your mind's eye. See that person. Look closely, just like we looked at those paintings. Look at their eyes now. How do they return your gaze? How do the eyes move about? What is that person's story? What is that person's race, that person's socioeconomic background? Does that engender any feelings in you that might interfere or enhance your perception? Look at the face of the person in front of you. How dynamic is the facial expression? Is the face animated? Is it moving? Or does the face seem like a mask, as in Parkinson's disease? What about the skin of the face? The color, the moisture, the complexion? What can you surmise about the perfusion of the skin, the circulation, the hemoglobin level? What can you surmise about their mood and their self-regard? In my mind, I see a patient in my office. She's in her late 60s, well-dressed. Her gaze is direct and forthright. Her cosmetics are expertly applied. Her skin is smooth, pale. Her mouth is set firmly as she awaits my invitation to begin to give her medical history. Do you see your patient? Can you conjure up that image in your mind? What about the clothing, the stature, the posture, the movement of the body? Is your patient in a hospital bed? How are the sheets and bed tray arranged? How does your patient organize his immediate space? Notice hands. How is that person's chronologic age marked by the texture of skin, the density and heterogeneity of pigment? Notice the movement or the stillness of those hands. Now focus on how your patient breathes. Without timing respirations, get a sense of the rate and the rhythm. Is there the normal end expiratory pause between breaths? That stillness between taking breaths? Or is it taken up by motion, whether driven by anxiety, by pain, by lung consolidation, by fluid in the pulmonary interstitium? In this moment, before you've exchanged words with the patient, you already know much about this person. Without realizing it, perhaps, your mind has registered a rich appreciation of how this person is now. My patient accepts my greeting and proceeds with her medical history. Her delivery is flat and practiced as she recounts cancer, its treatment, its recurrence, and the tabulation of complications and therapies. She's been trained by giving this story many times to many other medical subspecialists. The story reads like a medical student's HPI. Her gaze is direct. Her speech is fluent and practiced. Her demeanor and dress are professional. In her history, her suffering goes unmentioned. In her well-organized account, she leaves out any of her perseverance, her despair. About the obvious devastation and proximity to death, there is no mention at all. I stop. I tell her how powerful her story is. What you have been through must have been very difficult. And she's quiet. Her clear eyes moisten. Her face with emotion. The office visit is transformed. She's no longer an objective reporter to yet another medical subspecialist. I'm no longer just a white-coated authority. We are together, feeling human beings, coping with the brutality of metastatic cancer, its infectious complications, and the consequences of the required antimicrobial therapies. Now you listen to your patient as she begins to speak. Notice the tone and the rhythm of their story. Can you hear if the music of that speech is like a jazz solo? Is there a staccato of adjectives? Is it a dirge without details? Is there theme and variation and repetition of content? Does your patient describe their referral, their previous doctor's conclusions, the challenge of getting the appointment, their trip to getting to the clinic? If so, your patient is invoking a deeply engraved narrative structure. Your patient is describing what's sometimes called the hero's journey, an ancient storytelling archetype that's older than the Holy Bible. Now you have the eyes to appreciate masterpieces. You have the ears to appreciate symphonies. You have the heart to recognize the hero in your patient's journey, the archetype of your patient's medical history. You have both the task and the opportunity to reframe that story from one of victimhood to victory, from suffering patient to vital and whole human being. And you accomplish this task with your ability to perceive artistry and beauty in its manifold forms, the beauty of the world. Now, once again, take a deep breath. Blow out slowly. Take a deep breath again. If you've not done so, open your eyes. Using the chat box and unmuting yourself, what was this experience like for you? Without revealing any names or confidential details, who was the patient that came to your mind? What did you learn about your patient? During that exercise, were you able to see somebody? Did somebody come to mind? I'm curious about any reactions you might have had. How do you think evaluating a patient compares to looking at a painting the way we did before?
So we have a comment from Ann Walsh. And the comments are coming in now. Ann says it makes you look at the whole person and not just a diagnosis. And Nancy Berlow said that it's helpful to expand on how we look at someone. And Julia said that throughout this exercise, I found myself thinking about Sherlock Holmes and the investigatory nature of evaluating patients and putting together all of the pieces at your disposal to create a story and an understanding.
I was impressed in the exercise that we had with Nancy just a moment ago, at looking at a woman regarding her, the baby on the bed, and how the stories kind of emerged over time, and how emotional, the emotional tone of the images seemed to come through with all the details that were uncovered.
Yeah, I was thinking that in the pictures, we were able to look at the whole context. We had a scene in front of us. But when a patient comes into a doctor's office, we don't have that scene. And so it's picking out those elements of what's presented in front of us and what's missing. So you helped us like slow down and at least ask about what don't we know about this patient? What do I wish I knew?
So I'm going to invite some of the people who are making very powerful comments. If they would like to read their own comments, I can read it for you. But if you'd like to explain, I think, Greta, you had a very powerful experience. Do you want to unmute yourself?
Hi. So I guess like for me, I was particularly like I normally volunteer at a nursing home prior to the pandemic and hopefully starting to volunteer again there at some point. But I was particularly thinking of I would volunteer in like their lobby area and sit at a front desk there. And I would help like people who came in, but also a lot of the patients would come out, just want to chat or just have someone to be around if, just having someone be around can be very helpful for them. And I was thinking of like this one patient that I remember like, who would just like, sit there for a while and, he just wanted to be near someone, I feel like, because, even if we weren't talking much, he would just want to be nearby, I feel like sometimes like, even when I feel like, you have to balance like going to help someone versus like, also they just still want to sit there. And I feel like, it's kind of like thinking about like, kind of just like appreciating even like if you can spend like 5 minutes with them or like, even if it's like 15 minutes where you can just sit with them and like, no one else needs help or, maybe there's not someone else around at that moment seeking like conversation. So I feel like, just thinking about kind of like valuing that time and like, really trying to feel like, imagine what they're experiencing, even just thinking of the simple idea, like, just enjoying being in the presence of someone else, not even having to talk.
Greta, I think being in the presence of someone, even without words, there's a lot that we are picking up and communicating to someone else. And I think being aware of that is sometimes helpful. Making it conscious is useful.
Yeah, I think so. Thank you.
Thank you. Catherine, did you want to explain about your experience?
Yeah, I had this image of a patient of mine who was, I think she felt very close to me, but she also very, very clearly did not want to appear to be complaining or a complainer. And I think in this exercise, I was trying to think about her background and her upbringing and what she was taught in terms of how you present yourself and how, what is considered to be selfish versus acceptable to say about your own pain.
Isn't it fascinating with how a person frames their own story to themselves and to you. And the patient that I was describing, I felt that she was a professional patient and was sacrificing her humanity or keeping it under wraps to be able to get through the experience, and to acknowledge the humanity makes such a big difference.
Yeah, that's right.
Thank you. Suganthi had a question. Do you want to ask your question or comment? Make your comment? You want to unmute yourself?
Sure, sure. I was just wondering, with so many tasks to complete and we are rushing around and we have clinic full of patients, how many of us have the luxury to understand and even see the patient and patient's eyes and talk to them? I've had my own experience when I go to a clinician and they have to enter everything in the computer and they don't even have their eyes on me. So in the current world, where do we have that luxury?
What a powerful statement you're making about our healthcare system. We all have a task list. We have a lot of things to do. There are urgent things that we need to take care of. And how powerful it is to be looked at as a person, as a patient. Your observation that that doctor, that healthcare provider is taking down information and not even looking at you. I think the opposite of that is that when that person takes their head out of the computer for just a moment and looks at you and sees who you are, and that's not something that takes a lot of time. That's something that takes place in the pace of a breath or two. That can be, it changes the experience. And as a doctor, instead of just doing tasks and spending at least some time of every visit, taking a look and trying to be present and seeing who that person is, it changes the experience, and it makes it much richer and much less likely to burn out from the endless repetition of all these tasks that our electronic medical record sometimes commands us to do.
I agree. Sometimes you want to go back to the old times when the EMR was not there. I'm not a clinician, but I do have some experience seeing some patients many, many years ago. But I sometimes feel sad for the current. We are a lot. Are we achieving what we're supposed to achieve? That's my question all the time.
Thank you. Maria, did you want to talk about your experience? Maria Noreen? So Maria wrote, if you're there, Maria, you can unmute yourself. She wrote, I recalled the young boy after bone marrow transplant. We connected through music and I allowed him to lean on me for strength during the moment of pain and weakness in the early hours of the night. It's quite powerful. If anybody else would like to share, or if you have a question about anything we talked about today, you're welcome to put your name in the chat. I can call on you. Otherwise, I want to thank Dr. Hirsch and Nancy. Alice, you wanted to say something?
So I think this is so important, and we're having such a wonderful conversation here. And I don't see everybody, but I see a number of people. And I'd like to think how our younger medical students would respond to this. And I don't know if there are any medical students on this time. Sometimes we do. If it's sort of that generational difference, and what they're thinking about this approach to me is important, because we want to connect to our learners, and we're seeing this as a way to connect to patients, and we're seeing this as a way to understand how to think about biases. Just like in that first picture, there was a lot of bias about what was going on, and to think about who's in front of us and get the students to think about who's in front of them. And I just didn't know if there were any younger, it could be any type of student that's on. It doesn't have to be a medical student. It could be a nursing student, a PA student, any residents. I don't know who's on exactly. I haven't recognized the name of somebody, so. But maybe not.
So I'm a fellow.
Oh, great, great. You're
So
eligible.
that counts.
Count. What are you a fellow in, Alyssa?
I'm PEDS trained allergy immunology fellowship now.
Okay, great. You definitely qualify for my question. So what are you thinking about this in terms of, younger, more students, residents, fellows?
So I think it's very interesting, and I actually took a class right maybe at the end of medical school. I took one of the narrative medicine week-long classes at Columbia, and then they also did a little bit of like art at the Met with that. And I think it's very interesting, and I really enjoy doing it because it makes you reframe. I think it's like a great way to connect, but I think it's hard to get people to agree to it, because until you do it, you're always going to say, oh, I don't have time for that. Because I was exactly that person. I just took the class because I was like, I guess it sounds interesting. And I don't know. And I was very much that like eye rolling kind of person to a lot of this stuff. But it really changed my outlook on things. But I notice again that even now, it's like other people have talked about, it's very easy to get away from that and end up, just typing and not looking at the patient. Like, what's your chief complaint? Okay, great. What's next? Like, so I think this is great. And I also think this opens up a lot, because especially the way we're using technology now to do this, opens up a lot with the younger generation, who very much knows a lot more even than me how to use Zoom and all different types of things. But I think it's hard to get people on board at the beginning. I'm not sure how to get that going.
Right. I think your point is well taken, to my concern, how to get the buy-in of the learners and who we want to present to and see this as a way.
I think the way to catch people is to somehow make them do like a tiny bit, like give them a little bit of mandatory something, and then they will get excited about it. But I don't know exactly how to do that.
We do this as an elective. Dr. Hirsch is with me in that elective, and Nancy's with me in that elective. Nancy does 2 sessions in the medical humanities elective for 4th-year students. Obviously, we used to go to the museum, and now we did it on Zoom this past year. So students who come to that elective, participate nicely in this. So, but I was just talking about more in general, how students would react to connecting this to learning clinical skills. We do it more as a medical humanities way to learn, but it's not connected to a course focused on clinical skills, which this is teaching you clinical skills.
I think when you're doing these exercises, like the way we did, so we looked, I think it makes the connection in each person. So, you know, with Nancy, we were just looking at it from an artistic point of view. And then with Dr. Hirsch, we sort of used those same skills, but connected it to a clinical encounter. So I think that's a really powerful tool, because when people look at, if they were just to look at art, they wouldn't necessarily think how to connect that on their own. So maybe to sort of show them in that pathway like that we did.
Right.
I think it's interesting in a piece of art how sometimes a detail illuminates and changes the meaning of what occurs, and focusing on obtaining the visual evidence, I think, is a very powerful concept that we can bring back into the clinical encounter. I think the details of what our patient, of who our patients are and how they appear, I think is a very important clinical skill to cultivate in ourselves and the people around us.
You know, Rob, you're on, right, Rob? And I know you commented. Hi, Rob. Good to see you. You know, that first observation session in the structure lab is really somewhat where you have your first cadaver and you observe the cadaver and who was this person, unfortunately was. And, but it is somewhat an artistic experience. It'd be nice to bring Nancy into that and maybe have her see how we do that. And she might even have some more insights for us on how to, you know, not the experience is fabulous, so I don't want to say make it better, but a different perspective from an art point of view, because there is an artistic thing to it, I'm saying. What do you think, Rob?
I was, oh, sorry.
Rob?
I just what Alice is describing is our first encounter with the body donor, and it's you know, whereas many programs historically would just kind of get right down to it and begin dissecting the body and think about it as a specimen of study. We give our students literally an hour to just observe and start to organize their thoughts about, as Alice said, who was this person? What am I seeing now? Some of the same things that Dr. Hirsch just mentioned, you know, was this person well taken care of? Did they take care of themselves? Were they well-to-do? What else was going on in their lives? And that reflection, I think, is a really big, important formative exercise for them.
I agree.
Yeah. I'm not a student, but I was an art history major a long time ago in college, and I just retired. But you know, I found when I got to medical school that the skill from being an art history major, a lot of it was about pattern recognition. And a typical art history exam is two different works of art, and you know, what's alike, how do you connect these two things? And that skills, you know, continued to be helpful throughout my whole career in medicine, and recognizing something and saying, I've seen this before. I have seen this before. I know what this is. It's maybe not exactly the same, but it has, some people would just call that experience in a medical career. But I do think for visual clues of things that training and as an undergraduate did come in handy. I remember first noticing it in histology. You know, in histology class, looking under the microscope and saying, this is like an art history exam.
And that's sort of how, I mean, that's sort of how medicine is taught and how it is. It's all about patterns, recognizing patterns, and then sort of going from there. I was an art history minor in college, so I very much remember having that same reaction.
I think what we have sometimes done with the medical students is to look at, you know, the work of art as the patient and noticing those patterns, noticing all those details. We had one session I remember very well where we had one person was describing a work of art that he or she was looking at, and the other person, their partner, was turned away. Alice, I think you might remember this.
Yes, that was great. And that was great.
And noticing, we take so much for granted when we look at something, thinking that everybody sees the exact same thing, the same details, we interpret it the same way. And the person who was turned away had to draw, just schematically, draw what the other person was verbally saying, and then turned around to see, is this in fact what was being described? And it wasn't about getting it right or wrong. It was really about one's own recognition of how do I describe and how do I hear and how do I put it together. So it's really fascinating.
That was a great exercise.
That's great.
Because we do oral presentations where we present patients, right, Bruce? Not in front of the patient, outside the room, and how people present a patient. If you really think about the detail of that patient, it would be very different than the traditional oral presentation about a patient.
And we leap to the pattern.
Right.
And we go very, very quickly to the medical diagnosis, as we were doing earlier today. And we omit the specific detail. And if we can include some of those in those presentations, it deepens the patient. It's not a case of congestive heart failure. It's a person who's breathing rapidly and leaning forward and is anxious about what their experience is, and it becomes a different experience.
Mm-hmm.
I think I missed Robin. Robin, did you have something you wanted to add to the conversation?
Yeah, I teach something very similar. I run an organization in New York called the Creative Center, and we do a lot of art and health work in hospitals. And currently I'm teaching probably my 30th course in visual observation for Health and Hospitals Corporation. And all the questions that you're talking about in the presentation to medical students is fabulous. But what I'm finding in working with both residents, fellows, and physicians is exactly what someone else said, the time it takes. And I put a comment in the comments in the chat section. You are now as physicians being asked to view patients in a room and they're already undressed in a paper gown. You don't even get to see them in their clothing. So no matter how we train our medical students, when they get out, quote, into the real world, and I'm telling you, health and hospitals is as real as it gets, the public hospital systems, you're not really getting to see the whole person. And you're mandated to see X amount of patients in a certain period of time. So how we keep that up and how we reinforce that, I was really thrilled to be hired by Health and Hospitals because they really are trying to get that, and I put another comment in, back to kind of Verghese's Stanford 25. We're now going to the Stanford 2 or 5. We're not even getting to go through the checklist anymore because we're so busy. Or you are so busy as physicians and nurses. And the other comment I want to make is a lot of what you are learning as young medical students are what nursing students learn through what we used to call SOAP notes, subjective, objective, assessment, and plan. And if we could all go back to that, if physicians could be trained to take that time, because they are often the ones who are getting the details and they're presenting them back to the doctor when the doctor walks into the room. So in visual observation, Nancy and I were trained in the exact same way. It's actually observation. Can you list everything you see? Can you take a deep assessment? Can you then observe quietly and carefully to gather more evidence? What do you think is happening here based on the evidence? And then the plan. What is the treatment plan for a physician? Or as an art educator, what's the story here? So we're skipping steps and we're mixing them up, right, Nancy?
Absolutely.
Thank you for being here, Robin. That's great.
And I think we take so much for granted, which again goes back to, as everybody said, time. You need the time to sit and listen as much as to diagnose and come up with the treatment. Mm-hmm.
I want to add one other thing.
a lot of the comments had to do with maybe restructuring some of the courses that you're teaching. And I've done such a deep dive into all the courses being taught around the country. Many years ago, my organization helped Harvard develop their course, which is called Training the Eye. Dr. Joel Katz is the head of that program. And that is a very specific course that ties clinical practice to art observation week after week after week. But that is a 2-semester course, which not too many medical schools have. And it really is considered a clinical course as opposed to a humanities course. And they work very closely with the Museum of Fine Arts in Boston. So I think, you know, do we give lip service to this? Do we integrate it into the medical school curriculum? But I'll tell you, even when I do one-shot deals and I take residents to the museum on a Friday night, I like to think it changes them more than just a little. You know, I think once you see that way, hopefully you'll see that way in the bigger picture.
Thank you. Thank you, Robin. Okay, so this has been really enlightening, and thank everybody for your participation. We have time for maybe one more question. If anybody has any question for Nancy, Bruce, or just another comment. If not, I want to thank our wonderful guests and all of our participants for this really powerful program. Thank you, Nancy. Thank you, Bruce.
Thank you.
Thank you.
Thank you.
It was a pleasure. Thank you.
Thank you.
Can you post emails of people somewhere so we can connect?
I
send them out to the group.
Lisa, you'd have to ask permission.
You mean the people who spoke or the?
Yeah.
Okay, I think Nancy already posted her information in the chat, but I can connect the two of you. Absolutely.
Thank you.
Robin, if you want to send an email to that email address on the screen now.
I just wrote it down and I will. Thank you so much.
Okay. Francine's asking if we will have more of these sessions. Do you mean specifically the art or just in general the humanities programs? Art of observation. We actually were talking about doing one in the fall. So keep your, you know, just keep looking at the emails and we'll definitely share with everyone who attended this program.
Victor,
Ashlyn, if you could save the chat, that would be great. Let's see.